All right, with that, we're going to go ahead and call this meeting of the Board of Education to order. Jonathan, I don't know if you have a flag for us for the pledge. If you don't, I've got a little one here.
I don't have one, Peter. It's Mike.
Oh, Michael, you're on. You don't have one for us? All right, that's fine. We can do it this way. All right. So we will do the Pledge of Allegiance. So if you could all rise for the Pledge of Allegiance. I pledge allegiance
to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right, so the first and only item on our agenda this evening is a policy. This is the second read of the policy. Monday was the first read of the policy. Prior to our meeting on Monday, I confirmed with town council because the policy is related to return to school, and that was specifically on our agenda on Monday. This does qualify as the second read of our policy, and she'd actually confirmed that on Monday prior to our meeting. So we are good there. So Ms. Downey, if you'd like to make a motion to put this on the table.
Yes, thank you, Mr. Bernstein. I'd like to make a motion that policy 4118.237, also it's known as 4218.237, also 5141.8, as presented to the board on our last meeting, be adopted by the board with one amendment that's come about based on discussion with some board members. We would like to modify or add language as the last sentence in the document that reads, in the event that the orders or mandates from the state of Connecticut regarding the wearing of face coverings are set to expire without further extension, within 1 week of being notified of and prior to such expiration taking place, the board shall meet to determine any modifications or revisions to this policy. Period.
All right, thank you. Is there a second to that motion?
I'll second it.
Thank you. Seconded by Ms. Hirsch. So Ms. Downey, if you want to talk us through it.
Yes, so as we said on Monday night, this policy is almost identical.
Point of order.
Yes, Mr. Scher.
You said that this is the second read and this was presented in the last meeting.
Yes.
It was not on the agenda in the last meeting and it was not posted.
It was actually posted and it was on the agenda as a return to school item.
Yeah,
that was cleared, Mr. Scher, that was cleared with town council. If you think you need to make a motion to do this on a one read, that's fine. We can do that if you'd like to make that motion. It's policy.
No, Peter, I'm sorry. I'm on our website right now. The only document that's there says this is an update that is verbal only. The item was Dr. Jones. It was not a duly noticed item about a policy change.
Well, that's fine. Okay, that's fine. It was supposed to have been posted on Monday's board meeting. Because it wasn't, we'll need to make a motion to suspend our policy on policies so that we could take it as a one read. I'm happy to make that motion. Or Dr. Francis?
I was going to say I move to make this policy change on one read based on policy number, if someone knows the policy.
9314.
9314.
And I'll go ahead and second that. Any discussion?
So your plan is to take up a policy change, suspending rules for a first read and a second read, which is different than our rules and our bylaws and our policies.
That's exactly, Mr. Scher, what 9314 considers.
I understand, Peter, to do it without public comment?
Mr. Scher, this is an extension of a policy that was in place for the entire last school year. It was discussed at our meeting on Monday. We've received numerous emails about this. This has been out there. So with that, is there any other discussion on the motion on the table to suspend the policy on policies 9314 for the purpose of taking this item up? All right, hearing none, we're going to take a roll call vote. Bernstein is a yes. Stowe?
Yes.
Hirsch? You're muted.
Sorry, yes.
Downey,
Yes.
Francis,
Yes.
Kelly?
Yes.
Ms. Kowalski is still not with us. I don't see her. And Mr. Sher.
So I just dialed in. I can't raise my hand yet, but I'm on.
Great. Sorry, you're there by your phone number. So we're voting on the motion to take up this item to suspend our policy on 2 reads because Mr. Sher is accurate in that it was not posted even though it was discussed.
Yeah, I vote no.
Okay, and Mr. Sher.
I'm obviously a no. I was not at the Monday meeting, but this is so off of our policies and procedures.
Okay, Mr. Sher, you're a no vote. We're not taking comments on no votes. So we're going to move back to the original item on the table.
Peter, you are not going to bully your way through this meeting.
Mr. Sher, I'm not bullying you. We normally don't take comment on a no vote. We're going to discuss the merits of the policy that is before us this evening. Ms. Downey, I'll turn it back to you.
Going back. So the policy that is being proposed for passing by the board is virtually identical to the policy that we had in place last year. You may or may not recall, when we passed this policy last August, there was also an executive order of some duration, not the entire school year. And this version of the policy has minor changes that were blacklined and sent to the board last Monday for review. Mostly ministerial. It provides clarity to our families and our staff about expectations and terms of usage, what qualifies as mask and usage as mask. It was expressed. I apologize for my dogs barking in the background. Some board members had concerns about it putting it in. There was a thought on PGC that putting it in place for the whole school year with the ability to revise as needed, provided efficiency and simplicity in the terms of not spending an inordinate amount of board time on a monthly basis talking about mask policy. Some board members expressed concern about that, extending past when we have mandates or executive orders. And I think it's a reasonable point to say that, and that's why I added the additional language, that if in the event that we do no longer have orders or mandates from the state, we will immediately as a board hold a meeting to look at whether the policy needs to be rescinded, modified, revised, in whatever makes sense with the medical evidence and the advice we're given at that time.
Mr. Kelly, I see your hand.
Sure, thank you. Ms. Downey was nice enough to work with me on changing or adding this a bit to the end. I'm sure it was myself and maybe others as well. But I just want to thank you for that because I'm not good with allowing any time to lapse when the executive order ends and there's not a decision made by the board and we put off the meeting until after that executive order might change for us to wear 100% of the responsibility of the decision of the kids wearing masks. I'm sorry, let me rephrase that. The kids having the option to choose wearing masks or mandatory wearing of masks. I want it to be our decision, a discussion to be made in a public forum for everyone to know that it's the Board of Ed that decided that the kids are to either wear masks or not. If the executive order expires, the governor does not extend it, in my opinion, there's probably a good reason for that. And if there's a good reason for that, I want to have a debate with my colleagues and decide whether that good reason where he did not extend the order or maybe there was no good reason, maybe it's random, but at least we discussed that. So we decide to either continue with the policy or end the policy or change the policy in some more suitable manner that because of the change in circumstance that has been discussed and decided. So I want to make sure we have that discussion and that meeting with the Board of Education prior to this expiring. That's why I asked Ms. Downey to add that bit at the end, and hopefully that covers that. If anyone feels it doesn't, I'd like to hear that.
other discussion, if you could raise your hand so I could see you, or Ms. Kowalski, I know you can't. Okay, go ahead, Peter.
Christina, why are we doing this? Why did you propose this?
Well, for the same reasons we had one last year, that we have to define what is and isn't an acceptable face covering for our students and staff. We have exceptions about inside and outside. It goes, the state is pretty much just face coverings. It doesn't provide any clarification to our families and staff. And we were in the same situation last year in terms of needing that clarification, which is why we as a board adopted it last year. And we had a sunset clause for the school year. I wish we weren't having this discussion. I wish we were sitting in a position where no one had to wear masks. I think we were all hopeful that we'd maybe get through last year and we wouldn't have to deal with this year. And that's why we gave it a sunset clause. But unfortunately, we are in the position as we are. So it was done with the notion of kind of conforming to our practices last year and giving information.
Yeah, but I guess I'm sorry, I didn't, I don't understand why. I mean, back then, I'm just struggling with the inconsistency of policy governance and governance in this situation. Like, as an example, we had a full-blown COVID plan last year, and the leadership of the board made a decision that we would never, even the board would never even say anything about that. That was fully delegated to the superintendent. We never.
What do you, I'm not sure I follow what you mean, how that relates to this.
Can you let me finish? There was an entire COVID plan, and we did not vote on it one way or the other. The leadership said, this is, let the superintendent do that and she'll comply with state and federal mandates. Back then on the mask policy, there wasn't anything from CDC, the state of Connecticut. There was no specification. So you guys went through this whole drill of creating all of this specification. We're now finding ourselves a full year later. There's a lot of specification from the state of Connecticut and a lot of specification from the CDC. I feel like we're now, we're into micromanaging, which this board's talked about a lot. I don't understand why we just don't have the first paragraph of the proposed policy, which says the Board of Education, which is in this case, you're using it as the term as the local education authority, the LEA, shall comply with mandates from the state and the federal government. And then just let Tony Jones manage it, and let Tony Jones also, then you don't have to worry about dates and sunsets, because whenever the governor sunsets it, the superintendent can just go sunset it. I don't understand why we're not just giving a simple directive to the superintendent to comply with state mandates and the rest of it. All the rest of this is what happens if our board policy, and we've taken no public comment, what happens if our board policy isn't even correlated to the Connecticut State Department of Health nor the CDC? Did you guys go read all that and check all that?
We had the CABE Council told us it conformed to current status.
No, I'm asking.
And just listen. The notion of policy is to communicate, right, to our families and staff, right? So if we don't say anything about what is or is not a proper face covering, or what the exceptions are, and it is not something I guess we could delegate it to the administration, but I don't think that's wise to do. It is our way of showing the community what the expectations are. I'm going to let other people with their hands up speak.
Dr. Francis?
I did actually spend today looking to see what I could find from the state, because I was curious when this question came up as to how clear, and I went to the mandate, and then I went to the Connecticut Department of Education, the Connecticut Department of Health, to try and see if I could find clear guidance, like what's an acceptable mask and what are the various things. And it may be there, but with intentions of trying to find it, I couldn't find it. So I think it really behooves us to have something clear from our perspective that explains what it is and what the consequences are. We have lots of policies and lots of regulations and that clarify issues for our community. And I think it's important to have that clarified. That doesn't mean that we're going in and micromanaging each decision for each student or each exception or those things. We're setting the guidelines. And I think it makes sense for us to do that and have that clear.
Ms. Kowalski.
So my apologies for being late to the video portion of the conference. You can blame I-95. So look, my view on this is, one, I don't disagree with Dr. Francis in the sense that it's helpful to have a policy that says what masks are appropriate given the guidance. And I think that was a key focus for us last year, was to say gaiters are not appropriate and bandanas are not appropriate, and defining what kind of masks are in fact appropriate. My concern here is, as Mr. Kelly had suggested, is just the timing component of it. I was asked earlier today by one of my colleagues, well, there was a time last time and how come you have a problem with it now? And I was honest to hers, I'll be brutally honest now, which doesn't say much for me at the moment, but I was more focused on just that concept of defining what masks were acceptable and what wasn't acceptable, as opposed to the timing component. And at that time, we had a mandate that said, if you're going back to school, everybody's wearing a mask. And I think there was a key factor there that everybody just wanted to get back to school. So I had neglected and had an oversight as to the time parameters. But the time parameters do bother me greatly here because, one, there's a good chance, and I'm very optimistic about this, that we won't need masks. And we've gone back and forth with the requirements of masks in various scenarios throughout the state of Connecticut over the summer months, from not needing them to go into stores to needing them to go into stores, to not for some and some for other. And so my viewpoint on this is, I don't think my training and background gives me the wherewithal to be able to say when those masks should be worn and when they shouldn't be worn. And I think the government has come out, we have the Connecticut Department of Health, which is clearly staffed with people that have been guiding along the entire process, as well as the governor's executive orders, whether you agree with them or not, and the CDC, whose guidance has come out, who are far more equipped and have much more information than I do as to whether or not masks are required or not required. And my viewpoint in this is, it's one thing to have guidance to say, okay, what kind of masks are going to be acceptable, and that we will put them in place and we will follow the guidance from the CDC, the Department of Connecticut, as well as the governor mandates. But it's something else to say, well, it's all in place for a year and we're going to reevaluating. So it's basically us inserting ourselves into the decision on whether or not our children are wearing masks, when the government could have an entirely different understanding and saying they don't need to wear masks. Who am I to say that our kids should be wearing masks at that point when the government says they don't need to wear masks anymore? So I have concerns about making that decision, because I don't think it's ours as a board to make. I also think if we want to talk about this policy, I don't think we followed this policy last year either, given the fact that it went for a year and we went in and out of whether or not we were wearing masks at recess. There were times when they were at outdoor recess when they weren't required to wear masks anymore. That was changed. And it was changed for various in and outs of sports. And if this policy was in place at the time, they would have had to have, the children would have had to have worn masks. So I think we just need to be careful there. I'm comfortable in saying that we have a mask policy in place for as long as the government requires it. And I'm comfortable in saying what type of masks, based upon what we've been told, are the proper attire to wear for PPE. But other than that, I think we are subjecting ourselves and inserting ourselves into an arena where the 7 or the 8 of us don't have the competency to make that decision.
All right, Mr. Sharcia, you have your hand up again. Ms. Stowe, I see your hand up as well. So Peter, if you want to go, and then we'll go to Kathleen. Peter, did you want to speak?
Yeah. Karen, you said that beautifully and elegantly. I don't have a problem putting in place a mask policy. I have two problems with this. I think we need, we've talked many times on this board about not micromanaging the superintendent. Here we are micromanaging the superintendent through a policy, which it turns out in many cases when it was changed or violated, the superintendent didn't even come back and we didn't object. I wouldn't have objected. I don't think the board should be involved at this level of detail. That's part one. Part two is we should be following the state and other governmental mandates. And that should be the direction to the superintendent. And the superintendent should then go manage the rest of it. It's the superintendent's job, not Gaetan Francis's job, to go find out what the state of Connecticut and its health policy is saying, or what the State Department of Education is saying, or what the CDC is saying. When the board's in the middle of that, we're going to wind up out of alignment in this next year really pretty quickly. And Mr. Kelly is right to say, okay, well, how are we going to change that? Now we have to wait. We'll have to wait for if there's any time gap for the board to meet, for the board to have two policy reads, unless again we want to suspend our rules. I think it's just best if we give the superintendent the direction that we want to comply with health directives from the state, and we want to comply with health directives from the rest of it. Candidly, as Karen said, there's no one sitting around this table who is qualified at all to comment on the details of what types of masks and how then when in their shoe should be worn. There's not one of the 8 of us, with all due respect, Dr. Francis. I realize you're a physician, you're not a pulmonologist. So I'm wondering what we're doing here. And I think it would have made a lot more sense to have something streamlined that put this in the hands of the administration, gives them the flexibility to do what they need to do, and doesn't rely on having to schedule around us in response to changes that go on at the federal or the state level. It's just, I have no problem with having a mask policy. I have no problem with giving the authority to the superintendent to manage to it. There's such a level of detail here that I just can't get behind this. And we don't even have the answer of what is the actual state policy. We've relied on CABE. CABE's not a medical expert either, and I don't think they provide that level of expertise. So fundamentally, I'm not against this, but I think the implementation of this is wrong. I can't even find, as an example, Christina, you referenced the document in here, align something and something for fall 2021. I can't find that on the state's website, and the state's the one who published it. So we're referencing things that don't even seem to be publicly available, but maybe they are. It just, I'm here with the intent. The implementation of this is not right.
All right, Ms. Stowe.
So this is the policy that we opened schools with successfully last year, and other districts obviously did not have the same level of success we did. And I'm really proud of what we're able to accomplish as a district. I have to tell you, I have 3 kids going back to school with masks, and I'm not excited. No one's excited about it. It wasn't my lifelong dream to have my children go to school with masks. Believe me when I tell you that. That wasn't like, let's move to Greenwich, let's go to public school and let's wear masks. That wasn't ever in my sort of calculation, but we are where we are. Clearly the country has had a setback. Our state has had a setback. I mean, our first selectman even noted it, and we just need to be smart right now. And I like Joe's amendment because as soon as we can, I want us all get back together. And believe me, if the executive order were to end on September 30th, I am happy to have a meeting that day. So I think we all have good intentions. We just want to keep the community, our children, the teachers, the administration, and the community safe, but we're following the guidance that's been set forth. So there's not really much more to say on that. I don't pretend to be an expert. I'm just following what the executive order has, the CDC has, and the Department of Public Health. Thank you.
Thank you. Mr. Kelly.
Governor Lamont is a cable TV executive. He made an executive order that told us that the kids have to wear a mask till the end of September. When that executive order expires, or when we're informed it's going to expire, I think we should meet, like we talked about, as a board and then make the decision based on, and we could decide that we want to put it on the superintendent to make the decision after the executive order is done. If we decide to do that as a board, we can certainly do that. But I certainly want to lick at getting together with all you folks and deciding what is the best thing for our community, because we got a diverse bunch of people and a lot of people who are their intentions are great. And we hear from the community, we're elected by the community, and we should get together for the community to make this important decision that there's so many different opinions on. So to leave it to once the governor decides to pass it off and says, you guys figure this out, I'm done making the ruling, then I think we have to meet not the day of, but prior to, and decide to extend it, to cancel it, or to modify it in some way, or maybe even what Mr. Scheer is saying, give it off to the superintendent to decide what to do. If that's what he's saying, I'm not quite sure. But if it is, then we could decide to do that. But bottom line is, it definitely falls into our court to make a decision. The ball is passed into our court to make a decision, and we have to get together and decide something. We can't walk away from this. We can't blame it on somebody else. We have to take full responsibility for this decision once the governor passes it off. Well, that's my 2 cents. Thank you.
All right, Ms. Hirsch, and then I'm going to go, and then Dr. Francis will come back to you.
I was just going to say, we're a policy-driven board. I do think it's necessary for us to have a policy on this. I think it's actually something that CABE has told us that we required to do, but I can double check on that. And this is the same policy that we had last year. I appreciate the changes made so that it is not, when we thought to put it in as a year, as Christina, Ms. Downey had said, we thought it would just make it a lot easier for people to understand what the requirements were. But I appreciate that it didn't come across that way, that we could make changes at any given time. So I liked the change that was made. And as a sort of a statement of fact, look, much like Kathleen or Ms. Stowe, I don't enjoy wearing a mask, and my children certainly don't want to go back to school wearing one. But, one of the things we teach our children is to care for self and others. And that is what I am hoping that this policy explains to the students in the district, is that we are caring for ourselves and others. There are, many that can't, who have health issues, and that is why we are making this effort, to continue keeping the masks on and having a discussion about it. I do appreciate that once the mandate is lifted, that we can come back and have that discussion again, and to see where we are as a town health-wise. And again, I do like the change that we had made. So thank you for bringing that forward, Mr. Kelly.
All right, so I'm just going to talk briefly now. We relied on the health professionals last year in terms of the guidance to reopen schools. We obviously had good success with that. I haven't seen anything that tells me we should stop that now. I'm not for an indefinite policy. I never thought I'd have a mask collection like I have a baseball hat collection. That just makes no sense to me. I don't want to see people wearing them permanently. And maybe down the road, as conditions are changing, let's say we had 100% vaccination at Greenwich High School, and there is no mandate, but there's no vaccination for younger kids. Maybe we can change it for the high school. The possibility and the flexibility is there. The board can revisit this at a future time. We can get together on short notice. It takes 24 hours to do that. I would hope we have a lot more notice about when the state's mandate is going to expire. But if you've been, following what's going on in schools in the rest of the country that opened 3 weeks ago, it doesn't look good, folks. I mean, that's the real challenge. So, we'll keep an eye on here. We'll keep an eye on elsewhere. Obviously, we're watching what the state is saying in terms of the Department of Education, Department of Health. I know Mary Keller's on. We're listening to our local health professionals, and that's what we have to do. I'm not a doctor. I don't play one on TV, and I'm not going to start giving medical advice now. But I do know to listen when they talk and ask questions and try to make decisions. This is about the safety of not just our students, our staff, the families they go home to, the community members that they're around. I want to give a shout out to Fred Camillo for his courage and conviction for actually taking up the governor's he threw down basically the you towns figure it out for yourself, and Fred did, right? He talked to the medical professionals, he looked at everything we'd be looking at and made the choice for the town that's the right choice, and he will revisit it. And I think, Joe, I'm glad you called out the timing of this, right? We will revisit this. This isn't the last time we're going to talk about it. My guess is that order for September 30th is probably going to go longer, just seeing what the state has done, having been at this with them for a while. But at some point down the road, wouldn't it be great if we could lift it at the high school, at all of our schools? Wouldn't it be wonderful to go eat in a restaurant all together? That's not in the cards right now. And so we need to be aware. We need to be flexible. Look, if we have to change our schedules and get together, we do that, and we will do that. But I think at this point, this is necessary. It really is not very different from what we had last year. In fact, it really has the same bones as last year. I think we unanimously passed it last year. So I think it's a little ironic that even with this change, we're still probably not going to end up there. But I think we've all got consensus. None of us want masks, that we're all hopeful and optimistic that we won't need them down the road. So with that, Dr. Francis, I'll turn it over to you.
So a couple things. One is certainly someone who spends a lot of time wearing a mask. I would love to not have to wear a mask anymore, and certainly not to tell other people to have to do that. But I think, as with a lot of things, we have to do what's best for a large group of people. We have to care for ourselves and others, I think, as was stated. I know a lot of people have concerns about potential issues from masks, but I think there's no doubt we have to balance the risks versus the benefits. And there is no doubt in terms of the data that's out there, in terms of the scientific literature, that masks absolutely play a really big role in keeping everybody safe. And I'm so proud of how well our schools did. And it was one of the first things I said when I joined the board again. I think everybody did a fantastic job in making our students able to come to school extremely safely and learn, which is really what the schools are supposed to be doing. So this is enabling us to have our children learn and to be able to be at school. I think our governor, and I agree, I think our first selectman, Fred Camillo, coming out and doing his part in terms of our local community was amazing. But I also don't think that I, as a physician, I am not a specialist. You're absolutely right, Peter, sure. But I don't think I, as a physician, I don't think that I would completely rely on our governor or our first selectman as politicians to be making those decisions. So I absolutely would want to have the opportunity to have a conversation should those mandates expire, to go and look at the people who do. So our Department of Public Health, our CDC, and see what those recommendations are before anything would change. And so I do think this is a very reasonable compromise. I don't think any of us intended for this policy to be enacted for the year, no matter what. I think it was simply to say, we're going to put this in place to then be addressed when the time comes, but that is now clarified absolutely clearly with a timeline in terms of that. So I am strongly in favor of this. I think that, between the science, the need to protect our students, our community, their families, friends, spreading it to the larger community, all of those things, this is critical. Having our physicians, that's it. Thanks.
Thank you. All right, Mr. Sheriff.
Christina, I know that the governor required municipalities to pass individual plans and policies relating to COVID, move the flexibility. Just as a point of clarification, I think it's right, but I don't know your policy, so you know better than I would. The mandates are in place for school systems, and it doesn't require a board to, the state's not requiring the board to pass a separate policy, are they?
I have not been, I did not check that question with, I have not seen anything mandating it, but
Right.
it seemed the prudent approach.
Yeah, I was just curious if you knew, because as far as I'm
I
concerned.
don't have anything, I don't have anything I can point to that says that. I have not
Okay.
seen.
Because we're an organ of the state. We're unique in that way. And there are a series of mandates in place relating to the operation of schools from.
And you will see as we go through the fall, there are a number of policies that we are going to be presenting to the board that we do not have, that we're going, this is kind of part of the policy crosswalk process, that there are some additional policies that we will be bringing forth on a variety of issues.
Any of them relating to COVID-19?
No. Not that I've seen yet. I have checked what's, but the ones that we have some that we were just needing to revise or do for other elements of the school system.
And in our bylaws and I mean, we're already clear that we come to the public in our bylaws and our policies that we comply with federal and state statutes and regulations, right? I mean, that's a standard across our, right?
I believe so, but some things need, as laws
Okay.
change.
I just wondering if there was a special demand from the state to do this. I know that Fred Camillo had to do it because municipalities were required. The state left it open. I didn't think in
I
education they
don't know.
left it.
They may have required it. I don't know if they had required it, but we believed it to be the prudent course for us on PGC. That I can speak to.
Yeah. So we don't know.
I
We
don't
don't
think
know.
there's any, Kathleen has her hand.
Yeah,
I was
Mr.
gonna say, other towns are doing it. That's obviously and CABE presented a policy for the mask. We did it last year. They gave this as a sample. We're just re-upping the mask policy that we used last year, where every other town sort of followed the same model.
Thank you. Ms. Kowalski.
Thanks, Peter. So I just want to make sure that, my comments aren't misconstrued, because I do think a lot of the things that both Ms. Stowe and Ms. Hirsch and Dr. Francis have all said are something very similar. I think that in the sense that, yes, it was a good thing that we brought everybody back to school last year, as we're bringing everybody back to school this year. And last year looked, I think, much more grim than this year that it looked like, because we've got all kids coming back to the high school and not in a hybrid model. So we're coming back stronger than we did last year. And there's no doubt that we need to do it safely, and we need to keep in mind the safety of, and I don't think anyone on this call is saying that here tonight, that we're somehow not bringing back our kids and our teachers and staff and others in the building in a safe manner. And we do need to keep everyone safe, because yes, there is a broader implication of, who do you come home to every night and in the afternoon? I think the intent here is we should be following, as Dr. Francis said, obviously the guidelines that are being put forward by the CDC and the Connecticut Department of State, as well as the mandates that have come out through the governor. We need to follow those. No one's saying anything differently. I think that the issue here is the timing parameter and the ability that those institutions that have been guiding this state as well, and the federal institutions that have been guiding this country throughout this process over the last 18 months are more capable and have more information than we do. And I think that the reliance should be on that, as opposed to us 8 humble citizens making a decision that I think should be coming from somewhere else. And again, the timing component of it is troubling. And I appreciate both Christina and Joe working this afternoon to try to accommodate that change, because I did have that same concern. I just don't think it goes far enough. And for that reason, I think the intent is the right one. We're just going about it the wrong way. And that's where I have a challenge with this.
All right. If there's no further discussion, I'm going to go ahead and call the question. So the item before us is the mask policy as presented by Ms. Downey with the amendment at the end. So taking a roll call vote, Bernstein is a yes. Stowe,
Yes.
Hirsch,
Yes.
Downey,
Yes.
Francis,
Yes.
Kelly,
Yes.
Kowalski,
No.
and Cher.
No.
Okay, that policy passes 6-2. Obviously, we will revisit in the future as necessary per the language we've all just agreed to.
Peter,
Uh,
I'm sorry to interrupt you. The motion passed with the amended language that Ms. Downey and Mr. Kelly put in this afternoon.
Yes.
Okay.
Yes, when she made the motion with the amended language.
Understood.
but-
Thank you.
So we didn't need to do that as a separate amendment. All right, and we will get that cleaned up and posted with the amended language on the website, hopefully tomorrow. So, all right, thank you, everybody. Mr. Kelly, would you like to make a motion to take us out of meeting?
Oh, yes. From my mother's beach house in Breezy Point, Queens, I'd like to make a motion to adjourn.
I'm going to second that motion so Mr. Kelly can get to dinner. Bernstein is a yes. Stowe,
Yes.
Hirsch,
Yes.
Downey,
Yes.
Francis,
Yes, from Long Beach Island, off to dinner as well.
Kelly,
Yes.
Kowalski,
Yes.
and Cher.
Yes.
We are adjourned. Thank you, everyone. Have a good night.
Thank you all.